All right. Hello everyone. Welcome back to My Medical Message. Today we have Dr. Jeremy Grossman with us. He is a resident physician in internal medicine and pediatrics. So welcome, Dr. Grossman, to our platform.
Thank you so much. Thanks for having me, and thanks everybody for coming by today and listening to my
All right.
boring talk. Uh-oh. All right, we good?
Yep, we're all good.
All right, some back sounds. Anyways, so my name's Jeremy. I'm from California originally, and I went to school down there growing up, and I eventually went to college there as well. I have a beautiful PowerPoint. Let me actually share that right now with you all. Perfect. Slideshow. All right. Here's my nice cover. So currently right now I'm a senior resident out in Long Island, and I'm doing a combined residency in internal medicine and pediatrics. As I was saying, I grew up in Southern California, which specifically I'm from Aliso Viejo, California, if any of you know it. I went to high school down there, and I went to college at the University of California, Irvine, where I got a degree in biology, a BS in biology, and I got a BA in psychology. That was because I had trouble deciding. I don't recommend everyone to get 2 degrees unless you really want 2 degrees. I ended up taking a gap year off, which I can talk about a little bit later, before I went to the Sackler School of Medicine, which is at Tel Aviv University. I was there for about 4 years, spent some time here doing some rotations in the States. And eventually I went to my current position in Long Island, New York, where I'm at residency. It's also a combined program. Again, I had issues deciding in internal medicine, which is the management of adult patients, and pediatrics, which is the management of kiddos. And that's in the inpatient in the hospital and in the outpatient setting. And I'll talk about more of that in a little bit. So I chose medicine probably primarily because I'm a type 1 diabetic, and I've been in and out of the medical world for a good portion of my life. So it ultimately made sense for me. Is that the right reason for going into medicine? Not necessarily. I think everyone has their own reason for going into it. Obviously, I wanted to help people. I enjoyed some of the pathology, but honestly, I was never like the top of my class. I was never like the smartest kid in my class. So it just worked out. It kind of aligned with my values, and it made sense to me. I knew what it was like to be a patient, and I could, apply that to my patients and hopefully make their experience a lot better. So I chose internal medicine and pediatrics, the combination, because again, obviously I have issues deciding with things, but more importantly, I enjoy taking care of as much as I can before I have to call somebody else. With an interest in global medicine and going out, across the world into regions that are kind of remote and don't have access to a lot of things, it's really important that you get a really broad training so that you can, deal with anything that comes your way. Short of surgery, I wouldn't say I could perform surgery. Some emergency procedures, 100% I could perform, but that's a big reason why I chose med peds, which is the short term for it. I was also dual applied to family medicine, which is very similar, but it's more outpatient trained. So it's more in the clinic. It's less acute issues with patients that are in real emergencies. Although you do get that training, just not as much. And you don't get as much pediatric training as a family doctor. As a family doctor, you get mostly adult training. And instead of half and half adults and peds, a lot of that peds training that you'd be getting as a med peds doc, you're spending in OB-GYN, you're spending in the emergency room, you're spending in orthopedics, you're spending in surgery, neurology. So it kind of spreads out your education a little bit more, which some people might be into, especially in like a non-urgent setting. But for me, I ended up really loving hospitals and helping out patients who were really sick and seeing big recoveries happen quick. So 2 really good sites I recommend to everyone. If you're just thinking about going into medicine or you're interested in learning about a field, I would check out the National MedPeds Residents Association and the American Association of Family Practitioners. Those are both websites. AAFP, I'm more privy to. I think it has a lot of really good resources to learn about diseases and learn about different fields, because within family medicine, it's got like every specialty within it. And that's pretty much true for MedPeds too, in exception to some, but family medicine is a really great way for you to get your feet wet in medicine. And if you need shadowing opportunities, I think reaching out to a local family doctor, just going on Google, typing in family doctor near me, calling their office and saying, hey, I'm a student and I would love to shadow. That would be a really good way for you to get good shadowing hours. And I'll mention it a few times throughout the chat, but I give my Instagram out to everyone and I answer questions. I don't do like official career advising, but if you guys have questions regarding anything regarding going, through the medical school path, I'm there to answer it. I'm sitting on my phone most days. I have COVID right now, so I'm quarantining at home. So I have a lot of free time to answer your questions. So if I don't answer some of your questions, which I'm seeing a lot are popping up, if I don't answer them all today, please reach out to me online. And if you think of more than today, please reach out to me online too. It's Jeremy Grossman _, Jeremy Grossman _. And you can find it there, okay? So what kind of diseases does a med-peds doc really see? And again, there's a lot of overlap with family medicine, but we really see anything. So pneumonia, urinary tract infections, general surgical conditions, skin conditions, heart conditions, lung conditions, brain conditions. Really, when a patient comes into the hospital, depending on your age, you're either going to have a general pediatrician or a general adult doctor take care of you for most of your stay. And when your disease goes out of the scope of that doctor's training, that's when they call somebody else. So that's what I really love about my field is I'm really the decider of, I really get to have the most say in what happens to my patient. And that way I know that they're going to be getting the best care. I don't have to rely on anybody else. And when I don't know, I'll call somebody and they'll come by and help me out, and we'll put our heads together and figure out the best move for the patient. So what's really great about my training is I can also specialize too. So I'm actually interested in specializing in ICU care medicine. So people on ventilators, people needing blood pressure medication that raises their blood pressure because they're going septic or hypovolemic or they're in shock or they've had a trauma. I also love sedation, putting people to sleep, managing their awake state, and keeping them comfortable while they're going through a difficult time. So ICU medicine, like any other medicine, gets to have its bread and butter, kind of the things you're seeing every day. But it certainly, in my view, has the most exciting things going on, or the biggest shifts in patient status. So it really keeps you on your toes. And that being said, you really have to be careful because this patient's lives is in your hands, and you're almost acting as their organs, or at least some of their organs, maintaining their life. Okay, so I'm going to answer some more questions, but I'm trying to kind of cover as much as I can before I go down through the questions. So for those of you who don't know, this is the path of a medical doctor, or getting to be a doctor, whether that's an MD or a DO. So you go to college for 4 years, you can take a gap year like I did. Some people, you get a master's degree or a post-bac. I did some tutoring. I took my MCATs again, got some better grades. So med school is 4 years. The first 2 years there are your didactics, meaning you're just kind of in classroom learning. The second 2 years, you're going through different rotations with different types of doctors and working at the bedside and working with patients. So it's very cool. Then you apply to your residency, which is anywhere from 3 to 7, even longer than that when you include fellowship. So I'm in this portion of this path, and look how long this path is. Oh my God. It's a long path, but it's a really rewarding one. And that's why I like to show this, because it's you really have to know what you're getting yourself into. Now, that being said, you can still do so much with your life, even if you're going into medicine. But keep in mind how much of your life you're going to be contributing to it. So as I was saying, I'm doing a residency. Normally it would be 3 years if I just did internal medicine or pediatrics, but it's combined and accelerated. So I'm doing it in actually 4 years. So rather than 2 3-year residencies, it's a 4-year program. Then I plan to go to fellowship. I'll probably apply to what's called PulmCrit, which is a pulmonology and critical care combined. They like critical care doctors to know all about the lungs because you're managing them with ventilators. And then afterwards, you're off on your own. So that depends, where you want to go. Do you want to work in an office? And this is probably the most important part for you guys right now. What's your end game? Do you want to work in an office setting? Do you want to work in a hospital setting? Do you want to work in your own practice? You don't have to work under anybody. Do you want to work in another country? What's your goal? Because all of this is going to kind of drive what happens here. Okay. Now up to here, this is pretty much the same for everybody. But through this process, you have to kind of determine what these steps are going to be to get to your final stage. So I like to talk about like what my general day looks like. I wake up in the morning at like 5 a.m. I walk my dog Zeus, who's sitting here. He keeps farting, by the way. I don't know if you guys can hear that. I gave him this weird food. No more. So we wake up at 5. I take him for a walk. I go to the hospital around 7, where I meet with the night doctor. The night doctor signs out all the patients to me saying, okay, so these are the patients you gave me when you signed out yesterday evening. Now I'm watching your patients overnight to make sure that they're okay. And now here's my list of things that happened and things that you need to do and things that I've discovered or images that I've done or labs that I need to done or things that I'm worried about. Now you take it on. So it's a teamwork. So there's a night doc and a day doc, and a night doc and a day doc. And usually the night doc's covering more patients because everyone's asleep, so less things are happening. So it's like usually instead of like 1 to 15, it'll be like 1 to 30 patients a night. And then I could sign out. I go see my patients. I do physical exams. I speak to them. I make plans for the day. And then the head doctor, as I'm training, attending doctor comes by. We see all the patients together. I tell him my plans. He says yes. He says no. Or she says yes. She says no. And then we have lunch. I catch up on any little bits of work I need to do, discharge patients, maybe get new patients to our floor in the afternoon, respond to emergencies that are happening in the hospital. And then at 7, I sign out to the night doctor and we do it all over again. So that's pretty much kind of a typical day in the life. And it's usually 6 days a week as a resident. If you're working, not one of the Cush residencies like dermatology or ophthalmology, which are like 5 days a week. But it's typically 6 days a week and occasionally 5 days a week. And on your day off, you maximize it because you only get 1 or 2 days off a week. Okay. So I think that's my whole lecture. So I think I told you I want to do ICU hospital medicine. So here's a great picture I found. You're really keeping these people alive. You have so many different bags. These are saline bags to give fluids to the patient. Looks like these are lipids or TPN to give to the patient to feed them if they haven't been eating for a long time. It looks like there's a pressure bag here if you're looking at intra-arterial blood pressures. This looks like some sort of a transfusion device, a massive transfusion for somebody who's bleeding. So there's a lot going on in an ICU room. And as you get more and more exposed to the medical world, you'll kind of understand things and you'll walk into a room and you won't have to look at each one of these dials because you'll kind of just know. It'll be implicit to you because you practiced and learned and studied so hard. Okay. All right. So now's the time for the Q&A. A lot of questions popped up. Let's see what we've got here. So someone says, hi, Dr. Jeremy. My question is, as an internal medicine and pediatrics physician, which medical professionals do you have to commonly interact with regarding your patients? That's a really good question. I don't know who asked that, but thank you for asking. I interact with nurses all day. I interact with, again, like my attending physician, and I'm a senior resident. So I'm going to be interacting with the interns, with the new doctors that just graduated. And I'm going to be teaching them and supervising them, making sure that, they're making, doing the right things throughout the day. Okay. Who else do I interact with? Social workers, right? So a lot of times we have to send people home, but it's not safe if they were living home and now they had a stroke and they can't walk and they need help feeding, eating, whatever. They need to go somewhere. So that's not free, right? So that has to be covered by people. Someone has to pay for that. So they deal with insurance, they deal with placement, they do a little bit of counseling as well. We have psychiatrists on board as well, and psychologists when you're dealing, with trauma and dealing with kind of your new situation. And of course, I deal with all the different types of doctors I call: surgeons, pulmonologists, hepatologists, gastroenterologists, neurologists. It goes down the line. I mean, every doctor I interact with. There's not one that I really don't. I'm trying to think. It's rare that even as an OB-GYN, I interact with OB-GYN doctors when I'm rotating in the neonatology, baby newborn ICU unit. I have to catch the babies, interact with them, talk with them, figure out a plan. And sometimes we have to take care of the moms if they're sick after they deliver too. So really everyone. And this is, again, we're talking about med peds, but a lot of what I'm saying is applicable to both peds and medicine and to a lot of fields. What do you think about the COVID vaccine for children? Are there any side effects or anything to worry about? So I can't give medical advice legally, over this, so I won't do that. I will say that the COVID vaccine was, I believe it was approved for children in the last day or so. I would recommend you look at the FDA website and look up any trials to see the safety of it. I would imagine it's very similar to the efficacy in adults. But again, I don't have that data, and we'll just have to see. If you have more specific questions about that and you want to just kind of banter about it, again, hit me up on Instagram, Jeremy Grossman _. We can talk about it. What inspired you to go into this field? How has COVID affected your workplace? Great question. Yeah, so COVID was really a bigger deal last year when we were swimming in COVID. We were swimming in uncertainty. I didn't know if I was going to live the next day. I was in my garb all day. Couldn't breathe with my 10 masks on. We didn't really know what was going on. So it was certainly a very scary and difficult time, because I think a lot of doctors, in fact, most doctors they sign up to help their sick patients. They don't sign up to potentially be sick themselves. So it was almost kind of like being a frontline worker. That's what I called it. It was almost like war, right? You're putting your life at risk. We didn't know what the capabilities of this virus was. I mean, we did really know, actually. It was killing people. So I think the residual effect of that now is every patient that comes in, we test them for COVID, for isolation, right? If we don't want to put them in a room with another patient who doesn't have COVID, but also that, if they have COVID and they're asymptomatic, some of their symptoms might be attributed to the COVID. So we have to treat the COVID rather than figure out whatever else is going on. And the residual is obviously we're all wearing masks, which is now held down, but, or rather stopped by the CDC, but I just got sick from COVID. So for the time being, I'm going to keep wearing masks because I was double vaccinated, and I'm like kind of shocked that I still got it. So I don't know. We'll see. Great questions. Hit me up privately if you want to talk about those, chat about those. Do you work with any other specialties on certain procedures? So I would imagine you're talking about like getting your hands wet or getting your feet wet with things. Yes, we definitely do. And that's really physician dependent. So I really enjoy doing procedures. So I'm getting certified as much as possible. So a couple of procedures I do are central lines, suturing, midline procedures, catheter procedures, urinary catheter procedures, paracentesis, where you put a catheter straight through the abdomen and drain the fluid, and in problems like liver disease and kidney disease. Intubation, right? Getting people intubated and helping to help them breathe. There's a long list. What else do I have here? If I think of more, I'll mention it. But you can really do anything short of surgery. In theory, you can. Your scope allows you to do it, but whenever you do a crazier procedure, you're putting yourself at risk for malpractice and harming the patient, right? Is it better that you, who have done a few of these procedures, do it on this patient, or is it better that the person who literally does it all day do it on the patient? Because they have more practice, they might know what's going wrong, they might be able to troubleshoot different issues. How did you know you didn't want to specialize further? So I do want to specialize further, right? I mean, there's really not really many steps after ICU. So like right now, I could stop right now. And a big reason I chose this step right now is because I wasn't sure where I was going to go, and it kept the most options open for me, which I think is really important when choosing medicine, when choosing your degree, when choosing job opportunities, everything. You got to keep the most options open because your mind changes and you grow and you change as a person. I thought I was going to be a general internal medicine pediatric doctor in the hospital, but recently, the last few months, I decided I want to do ICU medicine. I really enjoyed the acuity, I enjoyed the intensity, I enjoyed ventilation, I enjoyed sedation, everything I was saying. So I kept that option open, and now I can apply next year. Before I graduate, I can apply to a fellowship now. Now, if I wanted to specialize after that, I could as well and do interventional pulmonology, which is bronchoscopes going down to the lungs and doing surgical procedures and biopsies, etc. How has COVID-19 impacted children who have internal medicine and pediatrics related illnesses? So it's like, COVID-19 at the end of the day is just a virus. So one, it's going to make you feel icky. Two, you're going to get more secretions in your nose and potentially in your lungs if it travels down that far. You'll run fevers, body aches. You can have acidosis in your blood. So that can all these sorts of things can interact with other conditions and make other conditions worse, or the other conditions can make the COVID worse, right? One reason that I kind of hypothesize why I'm symptomatic from COVID is I'm type 1 diabetic, so I'm immunosuppressed. So it kind of like I was saying, every time we have a new patient come to the hospital, you have to think about everything going on with the patient and how they would all interact. And you got to try to be as preventative as possible rather than reactive, because you want to make sure that the patient's safe before something goes wrong, and then you have to fix something, right? It's impacted, I think, adults a lot more than kids, but there is something called there's this severe syndrome of COVID in kids. And it's can be very severe, and it's kind of like a sepsis kind of state, and you could potentially die. And from the news, I know some kids have died from it. Again, every person is their own patient, right? You can't apply all the same rules to every patient. So and everyone has their own mix of diseases, and they all interact, and their medications interact. So good question. How did you decide that you wanted to pursue both internal medicine and pediatrics? I think I spoke about this earlier. My first question is, what is the age group of the patients you treat? So I can treat any age from 0 to on. And if I were to do something like palliative medicine or prenatal counseling, I could treat someone before they were born. So really, you can do anything. I really encourage you to go on NAMPRA, NMPRA. It was in the slides before. Please check it out. It's a very, very cool website. But it's a very specific niche field. So most people don't go into it. It's a very small field. So you really have to enjoy what you're doing. But I will say that most fields have become niche, or they can be made very niche to do just what you want to do, which is nice, prevents things like burnout. Do you mainly work inpatient or outpatient? What is your most interesting case? I mainly work inpatient. I do have a case I can show you after this. I did have a case of salmonella a few months ago, which was pretty cool. There's only a few hundred cases a year in the United States, and there's 6,000 hospitals, so it's fairly rare. But I've seen all sorts of crazy things. When you're at an academic big hospital center, a university center, everyone sends you the patients they can't figure out or that are complex. So, I've seen a bunch of cool stuff. Message me privately if you want to hear about cool cases. I can talk to you about it. And now, for those of you who don't know, inpatients in the hospital, outpatients in a clinic. I prefer the inpatient. The outpatient's equally as important. Preventative medicine and also, reactive medicine in semi-acute issues is very important. Because the last thing we want you is for you to be in the hospital. Once you've gotten to the hospital, it's kind of too late. You're kind of, all right, now we really have a problem we have to deal with, right? Okay. What is the main difference between med, ped, and family medicine? Is it better to do fellowship after you finish residency for med, ped? So med peds, med ped, my grandpa calls it med ped, but I appreciate you capitalizing it. I believe I spoke about it a little earlier, but family medicine doesn't have as much pediatric training, and it's essentially more outpatient. Okay, that's really the biggest difference. It's really clinic training, and it's really not very good as good on pediatric training, but it's still a very good field that I also applied in, and I was interested in working in. So you can work right out of residency. You don't have to do fellowship. You should really only do fellowship if it's your passion, because you've already donated so much of your life to this field, and everyone's really, no matter what you're doing, everyone's practicing some form of general medicine plus their little specialty on top of it. So if you specialize, you're just decreasing the amount of general medicine you're doing and kind of increasing that specific thing. So you really got to love it. If you love the lungs and you want to be a pulmonologist, do it. But I don't want to isolate myself to just pulmonology, right? I want to do critical care medicine, which is all diseases in a critical care state, right? And if I ever wanted to step back and just be a general hospitalist and deal with not as sick patients, that's an option I can have too. Lots of questions. Thank you for the questions, guys. What do you think is the advantage of your residency program against internal medicine or pediatrics residency program, respectively? So, I mean, med peds versus pediatrics or medicine, I wouldn't even put them versus, because you really have to want to do both or not. Usually people want to do just pediatrics or just adult medicine. They're very different fields, very different. The biggest difference I would say is pediatrics is a lot more social interaction family unit than it is with internal medicine. Kids tend to be not as sick as the adults too. So you're more of a holistic doctor as a pediatrician, and this is very general speaking, but you're more of a holistic doctor, I believe, than you are as an internal doctor, because as an internal doctor, you're dealing with so many medical conditions, you don't have time to be the most holistic doctor ever. But message me privately. Whoever said that, message me privately. We can talk about it. How long did it take to fully become a doctor in your respective field, and what would you say differentiates internal medicine from other types of medicine? So it took me 4 years of undergrad, and that was 2 degrees, 2 bachelors. Then I took a gap year, or I'll took a gap year. And then I took 4 years of medical school, 1, 2, 3, 4, that's 9 years. And then my current specialty is another 4 years. So 1, 2, 3, 4. So that's 13 years so far I've dedicated to my field. And I want to do, pulmonary medicine and critical care. So that's another 3 years, 1, 2, 3. So that's a total of 16 years to be what I want to be eventually. That's a long time. That is a long time. So you have to realize that that's your future, but it's okay, because you're going to be practicing medicine while you're doing it. So if you truly are passionate about what you're doing, it won't feel like you're in school that whole time. You'll be living your life being a doctor that whole time. So just keep that perspective, but also know that, you're going to be in school. There's going to be competition. There's going to be expectations people have of you. There's going to be long hours. It's not an easy ride. I think you get used to it the more you go, but each step is a very tough transition. And I had a lot of mental breakdowns throughout, because it's a very difficult path, but it's very doable. It's certainly very doable. Let's see. You also asked, what differentiates internal medicine from everything else? Internal medicine is everything medicine, minus surgery. So let's put it this way. The patient comes in, either myself or like an emergency doctor sees them in the emergency room, and we figure out what's going on and we take care of them, right? The emergency medicine passes them off to us, or we just continue taking care of them, right? When they become complex or they have other issues, they go to other services. Those other services might be an ICU, which are also taken care of by us. Those other services might be surgery. Those other services might be psychiatry unit if they just have a psychiatric condition. But generally, we run the hospital. Internal medicine and pediatrics, we run our respective hospitals, because we are the general medical doctors. We're the doctors of kind of everything, and we keep up to date on everything. I don't know. I don't know if a surgeon's going to know as much as I do about managing an acute kidney injury. But will a surgeon know about doing an appendectomy? Yeah. But that's why we have specializations, and we all count on each other, right? If there's a patient on the surgical service, sometimes they present with a tough medical problem that sometimes they manage, but sometimes they don't know how to manage, so they call us, and vice versa. Okay. Hi, Dr. Grossman. Since you specialize in pediatrics and internal medicine, how often do you work with other specialists? I think I answered this. How did you choose the combination of internal med and peds? All right, I talked about that earlier. How long was your residency, given it's 3 years long for IM and peds individually? I talk about that. It's 4 years. What new technologies are helping doctors of this field? What type of procedures do you do on a daily basis? That's a great question. Ultrasound is huge. You take a probe. I'm going to use my TV remote. You take a probe and you have a screen and you can watch literally live what's happening on the screen. So that means I can look at a heart, I can look at vessels, I can look at the abdomen to see if there's blood inside. I can look at the abdomen to see if there's fluid inside. I can use the ultrasound probe to find a deep vein and insert a catheter inside of it. I love ultrasound. That's a big part of my day. And it makes a lot of people's lives easier when I can troubleshoot their problems because I have this. You know, nurses, for example, they don't use ultrasound in my hospital. They can only find a vein, you know, by feeling or by looking and touching. A lot of times they have very tough veins or they're very edematous and they're swollen with fluid. So, you know, they don't have the capability to get the line in them. So sometimes I put a special line in them and I use the ultrasound probe to do so. If you have more questions about ultrasounds, please reach out. I'm very passionate about it. I can give you great resources to learn about them. All right, somebody else said, my 2 questions are, have you ever contemplated a different path? If so, why? What was the worst case you've seen and what made it so bad? I'm going to answer the first question. I've contemplated a different path, yes. I'm so busy in the hospital all day. Like sometimes I just like, I wish I was like worked at a zoo and just was like one of those jungle guys who walks around with the tigers. Or I like opened up a, you know, like a dog shelter and just like hung out with dogs all day. Or I went into business and I was a big businessman living in the city. You know, there's like a lot of things I wish I would do, but would I change it? Heck no. I love what I do. I mean, there's nothing else I would, you know, rather do. I can't speak for every doctor, but I really enjoy what I do. And I wouldn't change it. And even on my really long, hard days, I'm like, yeah, I did some crazy stuff today. I saved some lives and I'm really tired and I'm like really sad because of what I saw, but like, I feel pretty great. Like, I don't think any other job could make me feel as passionate about what I'm doing. Hit me up personally if you have questions or if you're contemplating a different path. I can give you kind of a sight to the future. The worst case I saw, I had a patient in the ICU who had locked-in syndrome. Their basilar artery in their brain or in their neck was blocked off, so they were fully paralyzed but fully aware, and they could see with their eyes and move with their eyes. So he was stuck, and he was trying to tell me that he wanted to see his family, and the mom, or rather his new wife at bedside, didn't want anyone to come in and steal her money because he was dying. So that was very difficult. So I tried to get lawyers involved and whatnot, and they eventually got me off the case because I was meddling with his personal life when I was trying to kind of help him out and give him what he wanted. So it was unfortunate because he couldn't talk and he couldn't say what he wanted. So that was a very sad case. He eventually died of shock. He lost a lot of blood through the GI tract. So that was a really tough case that sticks in my head. Hi, Dr. Grossman. How often do you get to take a break sleep during residency? That's a great question. I get to sleep every day. If I'm on service and I want to actually do stuff with my day, so that means research, see my friends, grab a drink, go for a run, walk my dog, call my family, whatever, watch Star Wars on Disney Plus, which I just bought, which is really cool. Mandalorian, very good. I'm going to watch WandaVision next. I don't know if you guys have heard of it. Someone said it was good. It looks corny, but we'll see. We'll see. I lost my train of thought. Yeah, so I'll sleep like 6 or 7 hours during the week. If I'm on like an outpatient rotation, just being an outpatient doctor, I can sleep like 10 hours. I don't have kids though, right? So I'm 29 and I have Zeus. So, but yeah, you sleep. You can take naps during the day. People do that. I don't typically nap during the day because I get more tired, but it's totally possible. And you can totally live a life outside of residency too, guys. I don't want to make it sound like there's like nothing you can do. You can. People do way more than me. I just like to like come home and chill with my dog on my days off, which I think is fun. Or go outside and like tan or something and relax. What is the most interesting case you've experienced handled? I think I just spoke about it. How did you decide to become an MD compared to other health professions? Why did you choose internal medicine and pediatrics over others? I think I spoke about all those. What is the most, sorry if you're coming in late, guys. I don't want to like make the people who've been here hear my answers to the same questions. But if you want to ask and you don't want to watch this video, just message me on Instagram, Jeremy Grossman _, okay? What is the most interesting thing in the pediatrics field? What was your favorite course in medical school? Pediatrics, I love PICU, which is pediatric ICU medicine. So I'm probably gonna be biased because I like ICU medicine, guys, don't hate me. But that's where you see a lot of the crazy stuff going on. There's a lot of really cool genetic conditions that you're just not seeing anywhere else. You just do not see them anywhere else. In pediatrics is where you see them. Something like cystic fibrosis or clotting disorders or diseases that, unfortunately kids can't live to adulthood because they have these traumatic, scary, terrible conditions. So those are the types of things you see, and they present in different ways. I won't get into the whole list of them, but if you have questions about specific ones, again, reach out to me. Is it possible to get 7 to 8 hours of sleep as a resident? Yes, I think I just answered that. Use 6 to 7. 7 to 8. If you push it, 7 to 8. Hello, how has COVID affected your practices? And do you work with any people at different specialties in the same area? I think I answered both of those questions already. Sorry. Message you privately. I can answer those questions. How many years will a fellowship be for ICU medicine? ICU alone, it'll be 2. Pulm Crit, which is pulmonary medicine and ICU, is 3 years. And that's what everyone's recommending I do. So I'll probably do that. So in the end, I'll be quadruple board certified. I don't need so many specialties. I just need to be a critical care doctor. That's it. But they're making me do all 4. So anyways, here we go. How many patients do you treat with chronic illnesses? Everyone. Oh my God. Internal medicine is chronic illness land. Everyone has chronic illnesses. Everyone. Hypertension, diabetes, stroke, cardiac disease, COPD, asthma, colon cancers, everything, literally anything. Everything is chronic diseases. Pediatrics, less chronic diseases. It's still there. Probably 25 to 50% of your patients are coming in with a chronic condition. The rest of them are like, if they're coming to see you, it's either a well check or they have a new issue that just came up. How do you take care of them throughout their life? Again, I'm getting pediatrics and adult training, right? So I know how their kid bodies work and their adult bodies work, and I know how those specific conditions work with those age groups. So that's why I can do that, right? What is one of your most difficult cases? How did you go about treating the patient? Okay, I think I answered that question already. I'm sorry. Would you prefer to go into PICU or NICU, and why? I would prefer, actually they're both pretty cool. So PICU is pediatric ICU, which is anyone who's, you can still actually be a baby, but anyone who's left the hospital usually goes to the PICU. So, and then anyone who still was born in the hospital, has been sick, just stays in the NICU. So you can have like a 2-year-old kids in the NICU. And you could also have 1-day-olds in the PICU. So there's like a big overlap. But PICU, they treat up to like 21. I would personally do PICU. I like interacting with the kids. I like the medicine. There's a lot more chronic conditions and things that come up. NICU medicine is very interesting. It also pays very well, very well. And you get to work with OB-GYN docs. It's a lot of fun. You're running around, you're doing procedures. But I just feel like in NICU, the types of things you're seeing are more limited than pediatric ICU, if that makes sense. Okay, somebody asked, did you ever think about opening up your own practice? Yeah, I did, but it's a lot of work. And I want to be an in-hospital worker. So opening up my own hospital is going to be really difficult. That's a lot of work. I don't know if I'm going to do that. But maybe when I'm old and gray and I'm tired and my back hurts and I just want to sit all day, maybe I'll open up my own practice, sure. One thing I want to do is, because I do want to work abroad, is supplement my income with telehealth medicine, which is, working over the phone, helping people out. Because a lot of the problems that we're seeing, even in hospitals, are in clinics everywhere, in urgent cares, you really don't need to come into the hospital. All you needed was just to say, hey doc, do you think I should come in? And the doc will say, no, I think you're fine. You can just wait a day or two. We don't need to see you or touch you or listen. A lot of times we really don't need to. And if you're a well-experienced doctor, you can pick that up just from what they're saying, how they sound, their disposition. Telehealth, it's the future of medicine. It certainly picked up during COVID times. All right, what time do we got here? All right, it's 7:45. Are there any more questions? Okay, here we go. How do you manage your emotion? I want to answer questions. I mean, I have a case we can do, but we can talk about a case, and if you guys want, I can send you the PowerPoint and you can read through it. But like ultimately, I think this is more important that I'm just giving you guys an insight into the future. If you want really cool cases and want to hear about very interesting ways to treat conditions and blah, 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 AFP or NAMPRA, okay? NMPRA, right? How do you manage your emotions around other patients' families after a patient passes away? Yeah, so this was a fear that I had before coming into residency, or even coming, before medical school. But my bigger fear was like seeing a dead body, which wasn't a big deal. When you do anatomy lab, if some of you have done it already, they almost look like figurines. They don't really look alive, so it's not as scary. So it's tough because I'm at a point where I'm kind of jaded, and I've seen such a large amount of death, and not more than normal, but a really a good amount of deaths that I'm kind of used to it. And they're not people that I know. Some of them were people that I spoke to and kind of got used to, and I was making them comfortable as they were passing away over hours or days. And I kind of knew them in a second. But I have a religious background, and I kind of believe there's something after. And a lot of these people who are dying, which are majority of them are elderly people. They've lived their lives. And a lot of them are kind of done. They've been suffering with a lot of chronic conditions, and there's no quality of life. You'll hear that word. There's really no quality of life anymore. They're sitting at home. They can't move around. They have a feeding tube because they can't swallow because they had a stroke. They're so decrepit. They're just bedridden all day. It's just not a quality of life. You kind of get to a point, and I'm not speaking from my own experience, but what they've told me is you get to a point and you just say, enough's enough. I've had a good run, and that this is the end. So, your goal as a doctor, and a lot of times as a hospitalist, is to make sure that they're comfortable. Make sure that you've comforted the family, and just be honest with them. Tell them you see this all the time, and it's important, for you to have emotions. You're allowed to feel the emotions and feel upset about it, but for me, it doesn't affect me as much anymore. Unless there was something I could have done, and the majority of times there's not. They already were on the way to the end, and their presentation to the hospital was usually kind of their last. Here it is. This is how I'm going to die, and they might be with you for a day or two or a week or two, but ultimately that's where they're headed, and a lot of times you expect it already. You can see it in their vitals on the screen. What advice do you have for students planning to go to medical school? What should we be prepared for? Know what medical school entails. Read blogs about how people experience it. And also read about, actually, that's fine. Read about blogs about medical school. Don't worry about residency yet. Read about the different types of medical schools. You have MD and DO. Both have equal practice, equal respect. Some favor DOs over international MDs, by the way, and some vice versa. So ultimately, at the end of the day, we all practice. Some of you might not know of DO schools. Look them up, Doctor of Osteopathy schools. It's essentially, in very layman's terms, you're a medical doctor, and you also have like chiropractor type skills. It's not that exactly, but that's essentially what it is. In fact, chiropractic came from DO, from osteopathy. And it's essentially a manipulation of the spine, and it's also been utilized to manipulate, a lot of different organs and positions in the body to, relieve problems and potentially treat illnesses. Very interesting field. I applied to it. I recommend everyone apply to USMD, USDO, and International MD. If you think you're too good for International MD or DO, I don't want you in my field. This is not about prestige. This is about being a doctor and helping people. And if you've got that much pride that you think you're too good to apply to any of these other schools and you don't have the grades, then sorry, see you later. Try another field. Okay? So just prepare yourself for what's ahead. Remember this this, this thing I put up here, right? I mean, this is really what you have to think about. Is this something that you're willing to do? And can you envision yourself, all right, I'm going to be 35 when I get out. Maybe some of you are in your late 20s now and you're thinking about going to medical school, which is fine. I'm going to be 40, I'm going to be busy. Am I going to have time for my kids? Going into the medical school path, it pings you around the country and around the world sometimes. You don't always end up where you want to be. So that's time away from family. I haven't lived near my family for 6 years. So if that's something that's going to be troubling to you, then, consider that. Okay? There's a lot of advice I want to give for planning on medical school. Just get really the best grades you can get. All right. Still have a good time. I would just recommend planning out every single day, hour by hour. I'm going to study this here, this here, this here. And at the end of the day, from this hour to this hour, I'm going to watch TV. I'm going to call my mom, whatever. Delegate each part of your day. And that way, every part of your day, you won't feel guilty that you're not attributing to another part of the day. Okay. Please message me for private questions. I have so much advice regarding that, and I'm sure you have specific questions. My major as an undergraduate was biology and psychology. There it is, up there somewhere. Biology and psychology. Why did I double major? Because I thought I was going to potentially be a therapist. I wasn't sure. I eventually just decided to do both. Has it helped me? Maybe, I don't know. But the biology did, that's for sure. Does your undergrad major matter for medical school? I don't think it matters for medical school as much as doing your prerequisites. But if I have a guy or a gal who's got a bio degree with a 3.7 GPA total, and I have a guy or gal with a, let's call it a social sciences major with like the pre-med requisites, and they're 3.7, who am I going to favor more? Probably the bio major with 3.7. They took much tougher classes to achieve that score, and they're going to have a much better background in the sciences to apply to medical school. There's a lot of it's very similar, a lot of crosstalk between medical school. Your first 2 years, or rather your first year of medical school, is really a regurgitation of bio or chemistry and a little bit of physics. What was the hardest part about medical school? I think like grades don't really matter so much because you're already there. It's really just about passing. Unless you're talking about the big tests like the USMLE, which is like the SATs of school. But there's just always kind of a baseline level of stress that you feel when you're going out and trying to have fun. Like, oh, I really gotta get home and study. Oh, I can't do this right now. So that's really the hardest part. I mean, you have ups and downs. You have really tough tests, and some subjects are incredibly difficult to grasp. And there's a lot of pressure and a lot of studying. And hey, if you're naturally smart and you pick it up, great. But if you're like me and you're an average Joe, you're going to be working harder. But when you remember the light at the end of the tunnel, it's going to be worth it. And I can say here now where I am that it's 100% worth it. But man, was it a long road. Man, was there a lot of stress. Man, was there a lot of good positive times as well. Right? Do you do any research as part of your job? I did research in medical school, and I published, and I'm doing research now. Yeah. We're supposed to do in our residency some form of an academic project, and I decided I actually wanted to just do research and publish. And I'm looking at how the rates of asthma decreased during COVID, and that's because asthma is caused by viruses. So because everyone was staying in and they were masking up and they were social distancing, they weren't getting the virus spreading, so there was much less asthma. So it just better goes to show you that. What's the etiology of asthma? So I just did a pediatric study, and I'm going to try to create an adult study as well. Is clinical experience required for applying to medical school? Yes, it is. I believe you can use this as shadowing hours to say this is clinical experience, but I would recommend you still shadow in person. If you don't know who to shadow, look up a family medical doctor near me on Google, literally type that in. Whoever pops up, go down the list, call their office. Hey, can I shadow you? I'm a pre-med student. I'm interested in the field of blah, 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 blah. Say whatever field they're in, and you'll shadow and you'll get to know it. Do not do the organized programs. I think that they are crap. You don't really get to do much. That's just my experience. Organize your own shadowing. That's my experience. Do you work with DO physicians? What do you see as the biggest difference between DO and MD? Yes, I work with DO physicians. Some of them are my best friends. The difference between them, there's actually no difference. We all like do the same thing. No difference. Some of them use their osteopathic, manipulation, but like none that I know. I've just heard of some in some places doing that, but none that I know use it. They're the same, guys. They're really the same. Do you think med schools are being understanding towards downward trend in GPA during COVID? I don't know if that's a thing. I haven't heard of the downward trend during COVID. Is that maybe just because you're virtual? Okay. Yeah, I mean, I guess that they could. It depends how far down your GPA went. If you want to like specific advice on your application or your background, just message me online. And anyone who has questions, Jeremy Grossman _ Instagram. We'll talk about your personal kind of story, and we'll see if we can make a plan together. Okay. Any more questions? Oh, what clinical experiences do you recommend for undergrad and med students? Clinical experiences, shadowing. Another big one is volunteering. If you don't volunteer, why are you going into medicine? If you want to make money, please don't go into medicine. First of all, you're not going to make enough money. And two, like, I don't want you in my field. Like, go work in business or something. Like, there is money to be had in medicine, but it's not a field you go into for that. You go to school for 20 years to make a lot of money. No, go, go get your MBA and you can make double what I make. That's much better. But as far as volunteering, if you're not volunteering now, what's the point? What are you waiting for to give back? If you really I want to help people so much. What are you waiting for? I'm busy. No, you're not. I'm doing 2 specialties. I did 2 specialties before. I was in an academic fraternity. I was a resident advisor. I had a job. I played guitar. I was a restaurant worker. I did all this stuff. I had a dog. Come on, guys. You have time to go out. It doesn't need to be every day. Once a month, once a week, whatever you can do, go out and do something. Whether that's volunteering at a soup kitchen, whether that's walking dogs at a shelter, whether that's you going on your own, creating your own organization, which is super easy, which I did, by the way. It's super easy. And calling it something, getting people involved, and now, boom, you've got a beautiful resume builder, right? What I did in medical school was I grabbed people together, we made sandwiches, got waters, and we made surveys, and we went out and talked to homeless people and figured out why they were there. And we gave them resources on the nearest places for them to get shelter. We gave them sandwich, bite to eat, we talked to them. We recorded their experiences. We never published it, but I think we did give it to the local government agency to see that where most of the homelessness of the area is coming from. Okay, more questions? Anything else?
It looks like that's about it.
That's it. That's a lot of questions. Thank you for the questions. Wow, I feel really utilized. I appreciate the questions, guys. I've done some of these where nobody ever just sits there and stares at me like this, or their screen's black. So I appreciate the questions, guys.
Yeah. Well, thank you so much for everything. Thanks for going over everything. I know we had a lot of questions. And yeah, our viewers tend to typically have a lot of questions, so that's great. So thank you for spending the time to answer all of those and really explain everything. So that's about it. Thank you so much for joining us today and being on our platform. For all of our viewers, there's a Google form. The link is in the chat. So make sure you submit that by 9 p.m. It's just going to be quizzing you on stuff that Dr. Grossman went over in the presentation and stuff that he talked about, and answered questions throughout the Q&A. So thanks again for joining us today.
Thank you for having me. Reach out to me, guys. Jeremy Grossman _ answer all your questions, okay?